Thank you so much. Can we start? Thank you, everyone. Thank you for being with us and sharing the loneliness in Tel Aviv, cracking the innovation code. Thank you, Sharon, for joining me. And where's my flicker? They lost it. Anyhow, my name is Dr. Hila Oren. I would like to thank the Stavros Niarchos Foundation for bringing us here. It is such a pleasure to come to our neighboring city, Athens. And as they taught me, thank you so much. Kalimera. I refer to myself as a city maker, not a shoemaker, not a filmmaker, a little bit of a matchmaker, because if you want to crack the innovation code and make changes in cities, you have to be a matchmaker, a little bit of one. My passion is cracking the urban innovation code, because everything, we're in a mental health summit, but everything happens in cities. It's an era of cities, of global cities, and if we want to make a change, this is our canvas. This is where we make it. Just remember 3 years ago, remember our streets? They were neglected. This is in Tel Aviv. Maybe someone has been there, Rothschild Boulevard, but I'm sure your streets look the same. They were totally loneliness, pandemic, and as the USA Surgeon General says, social disconnection is comparable to smoking daily. We have to make a big change and have to make sure that loneliness is reduced and is not as a major part of our life as it is. So in Tel Aviv, we developed two innovative tools that we're going to focus on it to reduce loneliness. One is social impact bonds, which Sharon will elaborate in a minute, and the second one is public pockets of well-being. The Tel Aviv Foundation, and that is again a very nice and generate invitation of the Stavros Niarchos Foundation, where we can learn a lot, but we're trying to be a little sis to that. It's a city foundation promoting pluralism, equality, and opportunity to the residents of Tel Aviv-Yafo and to the commuters and tourists that come along. When we're talking about Tel Aviv Foundation, we have our mayor as the chair, which helps any city to promote anything, public philanthropy partnership by matching programs dollar to dollar. That means if we do anything, those things are matched by private gifts. Solving problems, and this is the main thing before I hand over to Sharon, means to create an impact. And how do we create an impact? Remember this, and this is not easy. You always have to cut red tapes and roll red carpets. If you want real partnerships, it's not about our egos, it's about partnerships. Partnerships are not easy. It's about us city makers to cut the red tapes, but it's about you guys to come on our rolling red carpets with our partners. And this is my opportunity to move it on to Sharon. This is your flicker for your slides.
Hello everyone, I'm Sharon and I'm the Director of Welfare, Social Services and Public Health in the city of Tel Aviv-Yafo. You can see here our vision, and according to that vision of the administration, for us, a human being is a human being is a human being. That's why we give more to those who need more. And we are going on from intervention to prevention. And we also would like to be innovative and creative. So we have 3 keys for success. The first one is dream, the second one is act, and the third one is connect. We connect to our residents. They know what's best for them. But we also connect to other organizations such as Hila and the Tel Aviv Foundation, NGOs and governmental organizations. But the real issue is to make a change for our residents with them. So every year we map our strategic challenges, and for the last few years, reducing loneliness across ages is one of the major challenges. And why? Because loneliness increases risk for anxiety and depression, it's higher risk for heart disease, it's higher risk for dementia, it's higher risk for stroke, it reduced productivity in work life and also in schools, and it diminished civic engagement. So what do we know about loneliness in Tel Aviv-Yafo? We know that a person, an old man or woman who suffers from loneliness cost for 7 years of life $15,000 for 7 years. It's a lot. We also know that 45% of the population in Israel report on an increased sense of loneliness. So our real aim, our real challenge is to develop and test tools to reduce loneliness pandemic for elderly people in Tel Aviv-Yafo. We also know that 15% of our population are residents at the age of 65 and more. One man told us, he was sitting on a bench in Yafo, which is part of Tel Aviv. He said, I'm sitting in a bench with a cigar. I know everyone. Everyone passed me by. I smoke the cigar until it burns out, and I'm left alone with my thoughts. It's very hard to hear it. And now another woman told us, being lonely is death. It's worse than that. Those are very hard words saying by elderly people in our city. We have lots of programs for elderly people in Tel Aviv-Yafo, but do they make the chance? Are we really making an impact? That's why in 2018, we collaborate with the Tel Aviv Foundation and SFI, Social Finance Israel, and we make a social bond to reduce loneliness among elderly people. Why social bond? Because we want to know what's best to reduce loneliness. In my administration, we have a responsibility for the money that we spend or on program. We are working according to the accountability. It means that we have to explain why we do what we do, why we spend money on this program and not on another program. So we started a pilot with the SFI to reduce loneliness. We use the UCLA scale to measure loneliness, and we have 2,000 participants by the average age of 80. 83% of them were women, and they all suffer from loneliness. Those are the results. What we see from the result, and we have 3 measures, at the beginning of the intervention, at the end of the intervention, and 6 months later. Why? Because we want to see if we are reducing loneliness, but not only reducing, we also want to conserve the reduction in loneliness. So what you can see here, that we succeeded in reduction the sense of loneliness among all the participants in the program. We know now that over the time we succeeded to conserve the results, the reduction in loneliness, but we also know that it works better with women. We know that this program works better with old people by the age of 86, and it's even better for Holocaust survivors. We also learn about best practices, and I'll speak about some of them. We know that the duration of intervention should be not less than 9 months. We use technology tools. We have a very good application in Israel called Uniper. It's a digital club for active aging. But we know that if we want to use Uniper, we should do it 2 months after starting the intervention. We also know that CBT works wonderful with elderly people. And we know that we should train the volunteers how to work with elderly people. So, to summarize, social bonds model allow us to provide better and accountable service to reduce loneliness pandemic. We also know that the partnership with Tel Aviv Foundation provide us a framework which allows us to dream and to act. Thank you.
To dream and to act. Thank you, Sharon. This is fascinating. 3 years ago, we didn't believe we would do it together, but it just showed you that it can, and we're sure we can still learn so much together. So when we say cracking the innovation code, social bonds are something that are measurable, smaller public-funded budgets, better results, fully measurable and accountable outcomes. This is a focus on the elderly. But let's take and jump to another innovative tool, and we're talking only tools, right? Public places. Who doesn't talk these days about public places and their importance? We call them the pockets of well-being. I believe it just like I have my own pocket here. What are urban public places and what makes them so innovative? Now, this is a question that looks odd, but just 5 years ago, we would refer to public place as a place you go around, you stroll, you run out. You don't meet people and you don't use the place as functional to work, to learn, to eat. Our streets are actually places where we can meet by decision, not by occasionally. Have a meeting, have a saloon, as young kids can do that, students can do it, elderly can do it, so we can learn and make out of for our well-being, and we're connected. We're very, very lucky to be consulted by the Bloomberg Associates, but Jeanette Sadiq-Khan, who was the first one to close Broadway Street with all her team and with Mike Bloomberg as a mayor. But what it really puts out is a fundamental human right. Just as clear air and free speech are, public space is a human right for all of us. We shouldn't leave it outside. The city, in a way, is an equalizer. Just around the globe, you have the equalizer where you have all the resources, where the best atmosphere is here. Whoever's been in Tel Aviv can know Dizengoff Square. Before, it used to be like a rampa on top of the roads. Now, when we lowered it down, it is totally different, and everybody feels this is their living room. Even on Yom Kippur, people came to pray there. That means all different communities feel this is their place, this is their home, this is where they can connect. So we're moving from urban planning, and probably here on the crowd there are people that are architects and are urban planners, to social planning, where the person, the human, is in the middle, from uses to users. And these are little adjusting words, but they are so important and so fundamental. So we're moving actually from the term space, which in a way is cold, to place, to public space, to placemaking, human design based on human terms. And I'm adding another thing, just because we could elaborate on that so much, using the gender lens. The men around here feel quite safe to walk at 12 p.m., even if the light doesn't really work here. I know we won't admit it, but most of the women don't feel that secure to walk at night. This is something, again, we have to put a focus, because the public place, remember, is a human right to all, not only to 50% of the population. And here is a place where I took the liberty of using the most beautiful public space that I saw. And if you've been there, 11:30 p.m. yesterday, this image actually is not at its best, because it was packed with people running, eating, playing, dancing. This is what a real public place is. Not only our squares outside, a rooftop, a lobby, a porch, a hallway. We can reimagine our buildings. Before, we didn't think our offices could be WeWork, right? Now we all share our office spaces. We didn't think about our Airbnb, about our houses. All these sharing economy gives us a whole different reaction to an outdoor living room, an outdoor office, an outdoor classroom where you can come out with your computers, get plugged, and start working. But remember, it needs to be functional. That means you have to make sure that all the places have shade, They have water, they have restrooms in the area, they're green, they have power outlets and Wi-Fi, distress buttons, sustainable outdoor furniture. This is really important, that the chairs could be movable, that the tables could be used, accessible and clear entry points where you can see each other. These are just the beginning of the list that we are making to make sure that the public space is as accessible, as homey, as fun as our own homes. And with making those places, they become actually a public pockets of well-being. So I think now you start understanding why we refer to this as innovative tool. There's nothing really innovative. It's not a digital or a technology wish. It's just a different way of looking at things. And the most important thing, since we can't forget we are in the summit, that the issue is to reduce loneliness. That means through social bonds, through public pockets of well-being. Hopefully, we will get all of you to join us in the effort to reduce loneliness globally. Thank you, Sharon. Thank you, guys. And for Sharon and me, thank you so much. It was really important to have 3 minutes for your questions. So we did it we're on time. And if anyone wants to ask us, here's the first question there. And the question is, in Saloniki you have pocket gardens, and the question is? You're just sharing how important it is.
A similar project. So I hope this will spread all over Greece, because some municipalities have these efforts.
Absolutely.
Congratulations, it's a very nice effort.
Thank you so much. Hopefully you'll all join us. Yes. Distress buttons are using technologies where you have buttons in the city. You can push them when you're in an emergency case. And then, since our city has cameras all over, the people that sit on the moked, on the whatever, on the control room, exactly. They can see where the problem is and can send someone very quickly to help whoever's sitting there and is distressed. Let me look at that side. Yes, here you've got the
conversation. I remembered a movie, Japanese movie, that it was a park, and they were going to sit with strangers to play a traditional game. And my question is, do you believe you can make places with games in order to make people feel more comfortable to speak with a stranger? Because a lot of times when we go outside and we don't know people, or some stranger come to speak to us, we think that, who is that creep?
So I'll answer it, because if I'm looking at elderly people, for example, what we are doing, we call it outside parliaments. It means that we took professionals like social workers or others, and we arranged those meetings at the beginning so people can really see each other. There is someone who is taking care or is looking, and then they continue by doing it alone. So we have our mission is to allow this to happen, and to make sure that people can meet outside. They don't know each other, but we help them connecting each other at the beginning, and then they continue to do it.
And to elaborate on that, when public space feels like home, the strangers do not really feel so much strange, but this is probably in the future.
For example, we also do it for families giving birth to their newborns, so we arrange meeting outside.
Last questions?
Excellent presentation. I want to ask, have you ever considered creating this type of spaces outside hospitals to release the stress from either the patients and also like relatives and the healthcare personnel?
So in Tel Aviv Medical Center, which called Hila, that's the name, there is a very big space at the roof of the hospital where people can go outside. The staff of the hospital take them out. My daughter was hospitalized 2 months ago, and we were sitting outside most of the day, having families and friends. It's very nice. It's very similar to what Hila shows. So we try to create it, yes.
And you actually, to elaborate on that, not only hospitals, schools, any institutions that are public, temples, mosques, should be used with their public spaces when they're not used for what they need to be used, just to give away to anything, not only for free, but also for special programs.
Do you have a policy? Whoa, sorry. Do you have a policy or program that trains people when they are with those that are in the elderly community, so there's no taking advantage of them situation? Any kind of protection and measure within your programs?
Yes, we do it. Actually, next week we're going to have special train with a new startup in Tel Aviv that we are going to train elderly people about the IT world and how to do the right things in the digital world. Yes, we do.
And to wrap up on that, we have a program called U95, Urban 95, how the city looks from a 95 centimeter for kids. So the same question that was just referring to elderly refers to young kids. Again, thank you so much in the name of Sharon and of me.
Thank you very much.
We really enjoyed it.